So one of the things that we're responsible for doing is actually investigating these diseases and infections that are reported to us.
Here's a question. Who keeps you and the people around you safe from the spread of communicable diseases? And what are they doing to make sure of that?
Hi, I'm Bill Metz with Jackson County Close-Up, and we're here today with Stacy Gregg. Stacy is a registered nurse, and she's also the clinic manager at your Jackson County Public Health. So thank you so much for joining us today.
Thank you.
First things first, I think that maybe people don't quite understand, but what is a communicable disease?
So a communicable disease is basically an infection with a microorganism like a bacteria or a fungus or a virus that is spread to us by other people, by animals, or by our environment.
What are the different types of communicable diseases that I guess we deal with here in Jackson County?
The diseases that we see most reportable that we investigate on a pretty daily basis are sexually transmitted infections, like chlamydia, gonorrhea, syphilis, HIV. But then we also want to pay special attention to some of the infections that have to do with the GI system, things like E. coli, salmonella, Campylobacter, that can cause people to become very, very ill, and that in some cases are also linked to outbreaks in other parts of the state and other parts of the county or country.
What measures does public health use to basically discover and keep track of the communicable diseases here in Jackson County?
So by law, laboratories and providers are required to report over 70 diseases to the local health departments. And then we also want to know about any outbreaks that are going on in our community. And we'd also want to know about any other illnesses that would have public health significance. So we rely mostly on laboratories, but also from doctors, nurse practitioners, PAs that are working out in our community to give us either report electronically or to give us a call to let us know that these infections are occurring.
Once you have the information together and you have a concern or what you're considering something that's spreading too fast or it might even be considered an outbreak, what does public health, what role do they play and what do they do in the community?
So one of the things that we're responsible for doing is actually investigating these diseases and infections that are reported to us. So most of the time that is done by phone interviews. Hopefully we're doing the phone interviews with the people that are infected with these diseases.
Gotcha.
But sometimes that's not possible, and so we're talking to, doctors or nurses or medical assistants that have seen these individuals. And what we're doing is we're finding out when they became ill, what their signs and symptoms were. We're talking about risk factors. We're educating them about the infection that they have, how to prevent the spread of illness to the folks that they're living with, and then also how to prevent the spread in the community at large. So, for somebody that has something like, E. coli or salmonella, we'd, make sure that they were staying home from work or school, that they're washing their hands, that they're not preparing food for their loved ones, those kinds of things.